In a video before, Dr. Cohen, you mentioned something about that, you're not only just straightening out the teeth, which is beautiful, wonderful, and which is probably the main purpose why 98% of people come in. But you help with, you mentioned the word sleep apnea and make sure that the airways are open. So a person who, let's say, doesn't need braces, should he still come to you for sleep apnea thing, for getting the airways? Tell us.
Really, the first line of evaluation of sleep apnea problems really should be with the physician and having a sleep study. There really is no way of proving someone has sleep apnea difficulties. You can guess that you do. People that wake up tired, if your mate tells you that you keep them awake at night, you stop breathing at night. There are a lot of signs of sleep apnea difficulties, but the only real way to prove it is through a sleep study. I get involved for a few reasons. Number one, areas it's being shown that when the jaw structures are really narrow, it tends to kind of crowd the tongue out, and as you squeeze the tongue, it tends to move backwards in the mouth. In some instances, it doesn't make any difference, but in others, if there's not much tolerance back there, it can add to sleep apnea difficulties. So a lot of times, we'll end up doing a lot of width change to the jaw structure to get more tongue room. The people that tend to have a lot of problems with sleep apnea, a lot of times also are we call it retrognathic. Their lower jaw is set back. The tongue is really the main culprit in this type of sleep apnea. And the further back that the lower jaw is, the further back the tongue is. In many of those instances, if we catch them young, we can help them grow forward. In some instances, we actually have to help them, along with jaw surgery, to actually make their jaw longer, to help bring that tongue forward so that they can breathe better.
And so is that something you do in your practice? And is it separate or from orthodontics? Is it incorporated, or can it be both, incorporated or separate?
They kind of go hand in hand as far as, I'm assuming you're talking about the jaw surgery aspect of it.
Well, I'm assuming about the whole sleep apnea, the whole jaw correction, which you might be doing as you do a ortho case. But what about people who don't need an ortho case but might have sleep apnea? They might have it tested. It's true, they have sleep apnea. And there are, of course, the oxygen machines they can put on, and they work wonderful, except people don't like to sleep with them, so they toss them off. And in that case,
if there's structural things that I can address, then it's worthwhile for me to get involved, because then I can actually improve something. The CPAP that you mentioned statistically is about 50% effective. It really is 100% effective when it's used, but it's only used about 50% of the time. At least from all the statistics. There are appliances that can be made to help position the jaw and or the tongue forward, and in some instances that helps tremendously too. I don't tend to do too much of that. I have a good friend of mine who specializes in that. He's a fellow of the American Academy of Sleep Dentistry, and so I kind of let him do most of those appliances. But I get involved in areas where there's enough structural problems that I could actually make a huge difference in a person's life by being involved orthodontically and in working along with, many times, the oral surgeon to help fix the problem.
Okay. Summarize again in a bulletin point way what those huge differences are. You mentioned them in another video, but you surely didn't mention them here. So just give us a short overview what those huge differences are. Good-looking straight teeth. That's one. We got that.
Yes, well, good-looking straight teeth, as I said, that's kind of a byproduct of what we do. If we make things fit together properly, they're going to be straight. We also want to make sure that the widths of the jaws are correct. The better width problem that we correct, the better, more room that the tongue has, and the better function that the tongue will have. We also want to make sure that our jaw front to back wise is in the proper position. The lower jaw holds the tongue. If the lower jaw is too far back, the tongue's too far back. And we want to make sure that it's in the proper position to have the tongue in the proper position also.
Okay. And that makes the person breathing better, makes them their muscle tensions around the neck, head better, makes them looking better, not only because the teeth are straight, but because the jaws are aligned correctly and don't look they just have been knocked off by Muhammad Ali or something like that, right?
Absolutely, absolutely.
Good. Well, all right. Here we have it. Very informative again.
Thank you.